Now tonight we are continuing to bring you team coverage of the nursing home crisis in New York as more and more officials are calling for an investigation into the crisis and now possibly the governor. Our 18 News reporters Ariel Salk and Austin Evans have the latest on what is being done right here in the Twin Tiers. We begin tonight's coverage from our Corning Bureau Chief Ariel Salk. Ariel?
Good evening, Jordan. A lot of confusion in nursing homes and adult care facilities after last week's state mandate. The facilities must have all staff tested twice a week for COVID-19, but questions about how this would be paid was not made clear in the beginning. Now, we know that employees must turn to their insurance, but that might not be a solution for all.
But there's still confusion on that, because you got a lot of the nursing homes and assisted living folks that are self-insured. So they're still like, we don't have insurance to cover this. And the governor's putting the mandate on, and he's not providing any resources.
If insurance does not cover the cost of the kits and the processing fees, then the responsibility lays with the nursing homes or adult care facilities. One local facility says they would have to shut down if they had to pay. Reporting live in the Corning Bureau, Ariel Salk, 18 News.
Thank you, Ariel. And continuing Steuben County coverage, joining us live over the phone right now is Steuben County Manager Jack Wheeler. Thanks for joining us, Jack.
Thanks for having me.
Of course. So do you personally feel a pressure from state governments to deal with the nursing home crisis on a local level?
Yeah, absolutely. I think, it's certainly, while it might not be our regulatory responsibility, it's in a time of a pandemic, it's certainly our responsibility as a county government.
Right.
I can tell you our public health department, Director Darlene Smith and staff have done a phenomenal job stepping up, and when the New York State Department of Health may not act, if we have to locally, we have. And, while it's been difficult, the safety of the most vulnerable population that we have, those in nursing homes and adult care facilities, is paramount.
Absolutely. My last question for you. Do you know if the state is doing anything else besides sending mandates?
Well, a lot of times we feel like the state, sends mandates specifically to county governments all the time, and
right.
We discuss that frequently. I know they're working very hard on solutions. We just hope to have a loud voice at the table to tell them what's happening on the ground in our local communities, especially upstate in these regional, small rural areas like we have, so that they know our perspective when they're making their decisions.
Okay, well, thank you so much for joining us, Jack.
Thank you.
And today, New York State Senator Tom O'Mara and other members of the Senate Republican Conference stepped up their ongoing calls for the Cuomo administration to take full responsibility for the COVID-19 nursing home crisis. Senator O'Mara says Governor Cuomo cannot leave this nursing home crisis to be addressed at the local level. While an investigation has been launched by the state's Attorney General and the DOH, Senator O'Mara and other lawmakers question the independence of that investigation, since the DOH is directly involved in creating the directives being questioned. Now, the governor has come under increased scrutiny for the COVID-19 crisis in nursing homes, where, according to recent state reporting, deaths total more than 5,000. GOP senators say that state-regulated nursing homes have continually faced budget cuts that resulted in staffing shortages, and the COVID-19 outbreak has worsened an already tenuous situation. Our 18 News reporter Austin Evans joins us live from the Satellite Center with more. Good evening, Austin.
Good evening, Jordan. In a rarely seen tense moment with members of the press, Governor Andrew Cuomo defended his policies regarding nursing homes during this pandemic. While answering questions, he said his policies reflected those of the federal government and the CDC.
A nursing home cannot accept a patient who they are not qualified to handle. And third point, we always had alternative beds.
He also said that at any point, a nursing home could not accept a COVID patient. The state could find them a bed elsewhere, and they were never close to reaching the capacity of hospital beds for patients. Reporting for 18 News, I'm Austin Evans. Back to you.